Merit Medical Systems presents the Snare Endovascular Snare System. The Ensnare Endovascular Snare System is intended for use in the cardiovascular system or hollow viscus to retrieve and manipulate foreign objects. Manipulation procedures include indwelling venous catheter repositioning, indwelling venous catheter fibrin sheath stripping, and central venous access venipuncture procedure assistance. The Ensnare is uniquely designed with 3 loops to increase the probability of foreign body capture over single loop designs. These loops are interlaced for structural integrity. The snare is constructed of flexible, kink-resistant, superelastic nitinol wire, enabling it to be introduced through catheters without the risk of device deformation. Platinum strands are incorporated in the snare loops for excellent fluoroscopic visualization. The Ensnare kink-resistant guiding catheter includes a radiopaque band that is easily visible during fluoroscopy. The 6 French and 7 French snare catheters are designed with a unique 15-degree angled tip, allowing them to be steered during placement. The Ensnare system is available in 7 product configurations with overlapping diameters to accommodate a broad range of vessel sizes in the body. Working snare diameters range from a minimum of 2 mm to a maximum of 45 mm. There are 4 components included in every Ensnare system: snare, snare catheter, introducer, and torque device. The Ensnare system is designed to accommodate a variety of endovascular procedures. The following procedures are examples of clinical situations in which the Ensnare could be used and are not intended to replace the Ensnare instructions for use. Additionally, procedural protocols will vary among clinical institutions. To capture a wire over the aortic bifurcation, access both femoral arteries. Next, introduce a wire through the sheath and into the ipsilateral femoral artery. Advance the wire to the aortic bifurcation. The Ensnare system is then advanced through the sheath and into the contralateral femoral artery to the aortic bifurcation. The snare is deployed and the working wire is advanced and captured in the loops of the Ensnare device. The Ensnare catheter is then advanced to secure the tip of the guide wire in the loops of the snare. The wire and snare system can now cross over the aortic bifurcation. To remove a temporary inferior vena cava filter, advance a vena cava removal system over a wire to a point just proximal to the temporary vena cava filter. Withdraw any internal dilators or components and advance the Ensnare system through the appropriately sized IVC filter removal sheath. Expand the snare, advancing and rotating the device to capture the hook of the IVC filter. Advance the snare catheter to secure the hook of the IVC filter. Advance the IVC filter removal sheath to completely retract the IVC filter from the vessel wall per manufacturer's instructions. Once the filter is completely retracted into the removal sheath, the Ensnare system and filter can be withdrawn. To remove a foreign body in the vasculature, access the appropriate venous or arterial system. It may be necessary to use an additional guiding catheter to access the site of the foreign body. Advance the Ensnare system to the site of the foreign body. Expand the snare loops by advancing the snare through the snare catheter. As necessary, rotate, advance, and withdraw the Ensnare system to capture the foreign body. The nitinol loops of the Ensnare will expand to the size of the vessel wall for retrieval of hard-to-get sidewalled objects. The foreign body is withdrawn. Withdrawal of foreign bodies may require the insertion of larger sheaths, guiding catheters, or a cut-down at the peripheral site. Please consult the Ensnare system's instructions for use for additional procedural instructions. To find out more about the Ensnare Endovascular Snare System, please visit Merit.com. Ensnare is a registered trademark of Merit Medical Systems.